I think education events where all of us can get together, talk in an informal way without the time restrictions that exist in hospital systems or clinic systems is really important, because we can just have that dialogue, talk about what's important, talk about how we can improve patient care, meet and discuss topics and patients of interest.
So learning is a continual process, and I don't need to tell this to the college. And part of adult learning is that iterative, incremental process. So coming to forums like this identifies your areas of weaknesses and areas that you're good at. And it's a more friendly environment. It's a non-threatening, non-judgmental environment where people can share their knowledge, wisdom, their fears, their strengths and challenges. So this is a great way to do it.
It's probably one of the big takeaways from this evening was that no matter if you're young, old, training, or you've been a physician for 50 years, everyone's still learning. So I think that having a collaborative approach to both trainees and physicians is really important, and this event seemed to facilitate that really well.
I think it's also very important that we can come together and learn from each other's specialties, because sometimes what I do in clinical practice, it might not make sense to the other specialties. And sometimes it's good to learn what other specialties do as well to get a more holistic idea of how we manage patients better.
I sometimes feel like when you're working in a hospital, it feels like you're working in quite a siloed environment. So I think opportunities like this allow me to interact with my colleagues in the primary care space, my non-clinician colleagues, and I think these forums are important to get that perspective, to enhance sort of collaboration, to get a sense of what your colleagues in these spaces are doing, and essentially how we can sort of help our patients better as a team.
Look, I think when you gather a group of experts like you gathered today, I think it's the conversation is always very stimulating. You gathered a cohort of clinicians from a variety of specialties. Normally, as clinicians, we only get to mingle with clinicians from our own specialty. So you had a variety of perspectives.
The cross-fertilisation is really important. No one is the bastion of complete expertise in any subject. We are learning the interconnectedness of everything. We need the interconnectedness of the physicians who take care of those components.
The most important message was interdisciplinary learning, how these different disciplines can complement each other when you're trying to attack a massive problem, no pun intended, called cardiometabolic syndrome. It's a cluster of shared risk factors, and to bring in all the various disciplines and to learn off each other, to learn from each other, was the key thing that came out of today's meeting.